When considering the nature versus nurture question, I think thinking about it black and white can lead us down the wrong path. The science points towards twin studies where certainly genetic vulnerabilities play a much greater role than even the environment. Individuals who've been separated at birth, if they have the genetic vulnerability, still develop substance use disorder at a similar rate, even if both were exposed to variable environments. However, the access and accessibility confers another risk factor that cannot be understated.